Hi, my name is Angela Wolfe. I'm a PharmD candidate from California North State University, and today I'll be talking about Albuterol HFA, which also goes by the brand names Proair, Proventil, and Ventolin. It comes in this aerosolized form and comes at a dose of 90 micrograms per actuation. So I'll be going over some patient counseling points that cover what this drug is used for, what you should tell your doctor before taking this medication, some things you need to know while taking this drug, as well as side effects. Also, I'll be talking about storage, administration, and what to do if you miss a dose. So albuterol HFA is an aerosolized form of albuterol, and it's used to open the airways in different lung diseases where breathing can be problematic and your airways spasm. This can also happen when people exercise as well, so it can be used for breathing problems during exercise. So a couple things you should tell your doctor before taking this medication are if you have any allergies to this medication or any component of the medication, or if you're using another medication that's similar to this one. Some things you might need to know while taking this medication is if you start taking this medication and it doesn't help with your breathing, like you have an asthma attack or anything like that, and the dose doesn't seem to work well, if it seems to get worse while you're on it. Also, if you are a diabetic patient, you need to make sure to watch your blood sugars closely while you're using this medication. If you're pregnant, plan on getting pregnant, or if you're breastfeeding, you want to talk to your doctor about the benefits versus the risks of taking this medication. Some side effects that you'd need to talk to your doctor about right away are any signs of an allergic reaction, high blood pressure, low potassium, any experience of chest pain or chest pressure, anything that really has to do with the heart. You would want to call your doctor about right away. Also, sometimes it doesn't help resolve breathing problems, but sometimes can make it worse. So that's something you would also want to talk to your doctor about. Some other side effects of this medication are feeling nervousness or excitable. You can also get a headache or feel dizzy. You can also experience upset stomach, shakiness. It can also cause some minor irritation to the throat and also a runny nose. Now, when you store this medication, you want to make sure to protect it from any heat and sunlight. It is very flammable, so you want to make sure not to puncture it or burn it, even if it seems like all the medication is gone. And when on this medication, you'll see the number of sprays that you have left. So you want to throw away the inhaler when you see that all of the sprays have been used. You might shake it and it might feel like there's something in there, but if it says 0, you want to just go ahead and throw it away. When you do store this medication, there is a mouthpiece. So when you store it, you want to make sure that the mouthpiece is facing downwards. So this medication is best taken if you're using it for breathing problems. This can happen with exercise, or if it's used specifically for exercise, you want to make sure to use it 15 minutes to a half hour before you work out. Also, if you're taking more than one drug that you're inhaling, you want to talk to your doctor about which medication you should be using first. When you use this inhaler, you want to make sure to shake it well before you use it. Normally, you can shake it for around 5 seconds. Also, you'll need to do what we call priming the inhaler first before the first time you use it. So I'll explain some more of this later on in the presentation. Also, for some, it can be kind of hard to coordinate the spray and the inhale. So sometimes you can use what we call a spacer with the inhaler that helps with its use and making sure that the medication is getting into your body properly. Now, if you miss a dose, you want to make sure that you take it as soon as you remember, but if it's close to your next dose, you can go ahead and skip that missed dose and go back to your normal schedule. Now, this medication sometimes is only taken on an as-needed basis, so if you are taking it for like the regular scheduled medication, just take it as soon as you remember. Just make sure not to double up on doses or take any extra doses. Again, it can be used on an as-needed basis, so you wouldn't have to worry about any of those missed doses. So talking about indication and dosing for Albuterol HFA, it's indicated for bronchospasm and specifically in the treatment or prevention for bronchospasms in patients with obstructive airway disease. Also, it's used for exercise-induced bronchospasm, and it's used specifically for prevention. So like I mentioned earlier, you can take it 15 to 30 minutes before your workout. It's indicated in both asthma and chronic obstructive pulmonary disease, which we also know as COPD. In asthma, we could use the meter dose inhaler, which is the HFA form. It comes in the strength of 90 micrograms per actuation or per puff. So typically somebody would do 2 inhalations or 2 puffs every 4 to 6 hours as needed. Can do up to 4 inhalations or 4 puffs every 4 to 6 hours for moderate to severe symptoms. In COPD, for acute symptom relief, you can use it again on an as-needed basis rather than just a scheduled medication. Again, you could use the meter dose inhaler, which is the HFA form, and comes in the same strength. And again, 2 puffs or 2 inhalations every 4 to 6 hours as needed. So the mechanism of action of albuterol is when it acts on the bodies, it acts on the beta-2 receptors, which are located in the lungs. So it causes a relaxation of the bronchial smooth muscle to open up those airways. Some drug interactions with albuterol include beta blockers, specifically non-selective beta blockers. What this can do is it can actually decrease the bronchodilatory effects of beta-2 agonists, so we want to make sure to avoid this combination. Some monitoring parameters of albuterol include those that are related to breathing, so our peak flow, our FEV1. Also, we want to look at blood pressure and heart rate. CNS stimulation. We want to make sure to monitor serum glucose, specifically in patients who are diabetic, also serum potassium, and also any asthma symptoms, whether they're getting worse or resolving. So talking about administration, I'm going to go ahead and start with patients who are maybe using this inhaler for the first time. So albuterol HFA is considered an MDI, which is a metered dose inhaler. When you use this medication for the first time, I mentioned earlier that we would need to prime the inhaler first. So priming the inhaler, we want to first make sure to shake the medication for 5 seconds. Once we have shaken the medication, we want to make sure to press down on the canister with our index finger to release medication. Now, when you do this, you want to make sure to hold the inhaler and the mouthpiece away from you to make sure that you don't get any medication in your eyes or maybe even accidentally inhale any. After you've done one spray, you want to wait a few seconds. Again, you're going to shake the inhaler and press the canister down again. And you're going to go ahead and repeat this 2 more times for a total of 4 sprays. Now, after you've primed the inhaler with your 4 sprays, now we're ready to administer the medication. So if you look to the right here, we're going to go ahead and make sure that we have the cap removed from the mouthpiece. And again, you're going to make sure that you shake it well. So again, for 5 seconds, you'll shake your inhaler. Now you're going to hold the inhaler upright. So with the canister facing up, your index finger is going to be above and your thumb is going to be supporting the bottom of the inhaler. Now you want to make sure that you're not covering the mouthpiece. Now you want to make sure to take a deep exhale out, but breathe normally. And you're going to place the mouthpiece of the inhaler between your teeth, but make sure to form a tight seal with your lips around the mouthpiece. Also, one thing to know is you don't want to block that opening with your tongue, just because that's where the medication is going to be coming out. Now, you can start to go ahead, now that you have the tight seal, you can start to breathe in slowly. And as you breathe in slowly, you want to press down on the canister 1 time. And go ahead and continue breathing in slowly and deeply. And sometimes you can count down from 5, but just completely breathe in and hold your breath for as long as you can, typically 10 seconds, just to make sure all the medication is reaching your airways and the lungs. Now, depending on your dose, you can go ahead and, after you've held your breath, you can repeat the same steps that I just discussed right now, and do that for every puff. So if you're doing 2 puffs, you could go ahead and repeat that again. Just make sure that you wait 15 to 30 seconds between your next puff and make sure to shake the canister again. Then when you're finished, you can go ahead and put the mouthpiece back on and store it face down. Some side effects of albuterol include cardiovascular effects, CNS effects, and respiratory effects. I know that we talked about albuterol resolving bronchospasms, but sometimes it can exacerbate this, especially in patients with underlying disease. In terms of CNS effects, like I talked about, that side effect of excitement and nervousness, tremor, anxiety, any hyperactive behavior. Sometimes it can also cause insomnia. Now, albuterol acts on the beta-2 receptors. So sometimes it can cause effect on the heart, such as tachycardia, arrhythmias. It can cause QT interval changes. So these are some things that we want to look out for. Some warnings and precautions when using albuterol HFA are in patients specifically who have cardiovascular disease. Like I mentioned earlier, it can have some effect on the heart, so we want to use it in caution with patients with cardiovascular disease. Patients with diabetes, again, it can cause increased glucose levels, so we want to make sure to monitor that. It also may elevate intraocular pressure, which can cause glaucoma, and also it can stimulate thyroid activity, so it can cause hyperthyroidism. Potassium was one thing that we wanted to monitor. Beta-2 agonists can decrease potassium levels, so we're going to look out for hypokalemia. And also, we talked about the CNS stimulation. So we want to be careful to look out for any signs or symptoms of seizures in patients using this medication. And this concludes my presentation on Albuterol HFA. Here are my references.